Hello, and good day and welcome to GMC TV. Today we'll be discussing health issues and particularly Lassa fever. Lassa fever is a zoonotic disease, meaning it is transmitted from animals to humans. It is endemic in many regions, especially in West Africa. And so far it has claimed a lot of lives. But the irony is that most people do not even know the signs, symptoms, or what to watch out. In this edition, we'll be discussing what is Lassa fever, how would you prevent Lassa fever? And we have Dr. Siraj Abdulkarim, the Director, Planning, Research and Statistics from the Ministry of Health, to discuss about the clinical presentations of Lassa fever. So you're welcome.
Thank you very much.
I also have Mr. Paul Balogun, the Project Coordinator for the Community Development Initiative, who also talk about the public education on Lassa fever. So you're welcome to GMC TV.
Thank you so much.
I will begin with you, Doctor.
Okay.
What is Lassa fever and what is the difference between the Lassa fever and other hemorrhagic fever disease?
Yeah, thank you very much. Like you mentioned in your introduction, Lassa fever is one of the diseases that is causing a lot of morbidity and mortality, especially in West Africa, mainly in West Africa countries like Nigeria, Sierra Leone, Liberia, and some other countries in West Africa. This Lassa fever is it's a high burden disease in these countries, and it started as far back as more than 40 years ago when it was discovered here, coincidentally, in this region. So it is a disease that is caused by a virus, and when we talk about viral diseases, diseases that are caused by minute microorganisms that are rarely seen with even with a microscope. It's very difficult for you to really look at it and see it very clear. But it's just like HIV and some other viral diseases. But this viral disease is related to hemorrhagic. When we say hemorrhagic, diseases that damage blood vessels, and they may lead to bleeding, and so from either the nose, the eyes, and any orifices in the human body. It can cause that. So it's one of them. So there are so many of them. Lassa is just one among all these hemorrhagic fevers. If you can recall, we experienced the issue of Ebola, so it's just like that. So we have dengue fever and some other ones. All these are viral diseases that are hemorrhagic in nature. So for the Lassa, like you mentioned, it has to do with the rodents or from animal to human, and these are diseases. So for the Lassa fever is caused by a virus, that is the Lassa virus, which usually it gets its reservoir in a rat, and this rat is called marmonate rat, meaning that rat that has so many breasts in it. So it's the one. So you know we have so many rats, but the rats that usually keep this virus in it is marmonate rats, which has so many breasts. So by the time that you look at the rat, you see that it has a lot of breasts in it. So that is what is keeping the virus. So the rat that is carrying the virus, nothing will happen to it, but it will just keep it, and the virus, whenever it has an opportunity, it gets out either as a result of feces or urine of the rat, or any secretion that is coming from the rat as a result, either due to saliva or anything. Then by the time that it gets into human body, then it will multiply and start causing the disease. So that is Lassa fever and how it gets into human body. So it differs from the other hemorrhagic fevers in a way that this disease, Lassa, is usually gradual in its manifestation. You know, if you look at malaria and some typhoid fever and some other fever, the mood that they present in the human body differs from what we are seeing with the Lassa fever. So for the Lassa fever, it starts slowly, and gradual, then progressing to the extent that then somebody will start bleeding from any of the orifices in the body. So that is one. Then two, in terms of the severity, it also differs from other causes of fever or hemorrhagic fevers. Because, for instance, if you look at the Ebola, Ebola is also caused by a virus which leads to bleeding, but the nature of bleeding that Lassa caused differs from this, from the one that Ebola causes. So, and some people will even suffer from it without actually coming out with the signs and symptoms. They will even become infected, the body will take care of it, it will get out of the human body without really showing any sign and symptoms. So that is one of its manifestation, and so on and so forth. So that is how we usually see this disease. And it's a bit difficult for you to differentiate it from these other causes of fevers because of the way that it manifests. Because in the signs and symptoms, for malaria there is fever, for Lassa fever there is fever, for there is headache. So all these signs and symptoms are similar, but you have to have a high index of suspicion from whenever there is an outbreak or when we have one or two cases, then we start suspicion that there may be Lassa fever.
Okay, Mr. Paul.
Thank you.
One confirmed case of Lassa fever is an outbreak. How is the community aware of this Lassa fever? And what are the myths and misconceptions about Lassa fever?
Thank you very much. With regard to the community, we have been doing so many advocacies as well as sensitization to the communities. But if you still look at the trend of Lassa fever, especially what happens last year and this year, you see that although there is a reduction, but the case actually occur again. So that shows that there is need for more sensitizations within the community as well. One of the things that is actually baffling a lot when it comes to the community aspect, you know, people differs, tradition differs, cultural differs, and settings actually differs. One of the things is that people understand from the community are looking at Lassa fever as disease of the poor. So if you are not poor, so how can you come in contact with that and get infected with this, while forgetting that it can be transmitted woman by woman, actually through blood as well. And also, some people actually look at it, you know, not only Lassa, but other several diseases as from an initiation from the witchcraft. While if you look at the settings where we are in some part of Nigeria as well as West Africa and other part of country believe in witches. So they see Lassa fever as a manipulation of this activity where it's now narrow it down to some of those symptoms that doctor is mentioning. So they, whenever they see this kind of symptoms, they look at it, not Lassa fever is normal witchcraft activities which is carried out in the activities. Let's take him to the expert in the traditional aspect. So these are some of those misconceptions when it comes to Lassa fever in the community.
Sir, doctor, what are the signs and symptoms of Lassa fever? How would one know that this is Lassa fever, it's not malaria, it's not typhoid?
Yeah, like I said at the beginning, that it's a bit difficult for one to just see a case and say this is Lassa fever. So diagnosis is usually done through a laboratory test. That is the only way that you can confirm. But in a situation whereby we are having an outbreak, then once you see somebody coming with the signs and symptoms like fever, headache, abdominal pain, diarrhea, vomiting, all this, so you know we may be thinking of so many things that can be as a result of that. However, by the time that the doctor is examining that person or asking history, then you may realize that that person must have contact with any of the risk factors associated with the disease. For instance, if through history you find out that the person has been looking after somebody that must have suffered from the disease, then it's likely there is a likelihood that that person is suffering from Lassa fever, or he has contact with either any secretion that is coming from a rat, or he's dealing with the rodents like in a bush and so on and so forth. So there might be some history that will give you an idea that that person must have been suffering from the Lassa fever. But just from mere looking at somebody, you may not just say that person is suffering from that, because all the symptoms that I have highlighted, there are a likelihood that those symptoms can be as a result of malaria. Malaria, you know, somebody will come with fever, with vomiting, with all this. But when you follow the history, you find out that the thing is progressive. But for malaria, you know, within 2-3 days, somebody will manifest with all the signs and symptoms. But for Lassa fever, it will be gradual. You will start with the fever, which will last like 2-3 days. Then from there, it will progress to headache. It will progress to abdominal pain, like that. So it will be going. And within 2 to 21 days, he must have manifested with all the signs and symptoms. And towards a second, third week, you will start having the bleeding that is coming from either from nose, from mouth, the gums in the mouth, from eyes, and all these places. So that is how one will really suspect that, yes, that person will be having Lassa fever. Especially nowadays that in Nigeria we're having the outbreaks that is being seen across most states in Nigeria, and because of migration and movement of people from one state to another, then they must be transmitting it to a place. So that is why it's very important to sensitize the general public, for them to be aware that there is this risk that is going round, so that with the high index of suspicion, you will be able to now start looking for the disease. But if you don't really look for it, you know, somebody may even die without being confirmed with the disease, and that is the danger. Because if somebody died, you know, and you want to link it with what somebody is manifesting, it's very difficult. So it's very important for us, for people to know that this is how it starts, and that is how, if nothing is done, it will progress to death. And this is how the trend will follow from the beginning with the fever, then it will end up with the bleeding coming from all these areas. So that is how one can be able to recognize that. And so our call is for people to be watchful. To once you notice that somebody is coming up with a fever and it has not, after taking anti-malaria, the fever still persists, and any other antibiotics, the fever still persists, so that for typhoid, for malaria, by the time you take either anti-malaria or antibiotics, the fever will go. But for Lassa, it will persist and it will be progressive. So once you've started noticing that, then you need to rush to the hospital for confirmation and proper treatment be taken. Because one thing with this disease is that if treatment is not effective immediately or at the early stage, then that is what will lead to all these problems of death or complications.
Mr. Paul,
yes,
what are the cultural practices, the cultural beliefs and traditional beliefs that people do that fuels this spread of disease?
Okay, thank you very much. Looking at it from the traditional aspects, you know, when you look at some tribes, they believe in eating rats. Rat is like a protein, actually. So,
is it actually a protein?
so let's just leave it there. So people look at it from that aspect, and aside from that, they look at it as one of deliciousness in their meal as well. So taking their attention out of rat from rat is becoming one of things that they feel they may not really be okay with it. And secondly, you know, traditionally we have different method of burial as well. So if coincidentally someone is affected with this kind of disease, and the processes, looking at it from the traditional angle, without being mindful of the precautions of the health sector aspect, will actually increases these aspects, especially these processes or ceremony when it comes to the traditional aspect of burial. So talking about taking out the meal from people and then talking about looking at the diseases is more of affected with people who are from low classes being affected with it. And aside from that also, sensitization actually derail some places from getting access to this kind of informations where key informations regard to diseases of outbreaks or rather Lassa fever is of great concern.
Okay, so doctor, um, what is the transmission rate? What is the primary risk factor when it comes to Lassa fever?
Yeah, the primary risk factor is becoming contact with rodents or rats that is carrying the virus. So we call them infected rats. So that is the primary risk factor. So if somebody is coming in contact either as a result of contact with the saliva or with the feces or urine of the rats that is already infected with the virus, so that is a major thing. Then if that rat contaminates the food or water, then that is another problem, because the rat, for instance, if there is this habit that we have of separating food by the side of the road to dry it. So as a result of that, the rat can come in contact with that food, maybe try to eat, so its saliva can contaminate that food. So if you don't cook that food properly and the virus is inside, by the time the human inhale that or has eaten that food or water or anything that the infected rat becomes in contact with it, then it's a big risk factor, and the virus can now get access to the human. That is one. Then the secondary way of having is human to human. If like he has highlighted, either as a result of maybe looking after somebody that is sick, you know, we always, that person, if he vomits, or as a result of maybe trying to clean him off, after feces or passing urine, then the person that is looking after become in contact with these secretions, then he's likelihood going to become infected with the Lassa virus. So, and that will now lead to Lassa fever infection. So these are some of the, and then people that are dealing with the bush, maybe they are burning bush or they are doing some hunting of this in the bush and so on and so forth. So they are likelihood going to become in contact with the disease. So these are some of the risk factors that somebody may become infected with the Lassa virus.
So what are the complications? Are there, if not diagnosed or not treated, are there complications?
Of course. If any disease that is not taken care of properly, then it can lead to complication. So one of the commonest complications is, and is peculiar to the Lassa, is causing hearing loss. You know, it can lead to deafness and some of different variety, you know, starting from inability to hear gradually, and then, or not hearing properly at the beginning, then ending up with even complete loss of hearing. That is one of the major complications. Even people that survive the disease, at the end, you know, after some few months, they will start having hearing problem. Even though some people will recover from that, but some will have complete hearing loss forever. So that is another one of them. Then another problem is they may have some convulsion, or we call it seizures. You know, somebody will just be having like shaking and so on and so forth. So that is a complication, because it must have affected the brain and can lead to so many complications from there. You know, because the virus can cause swelling or inflammation in the brain, and which we call it in medical terms as encephalitis. And that encephalitis can be very, very serious problem that can lead to epilepsy and some other complications from there. So that is another one. Then another problem that could result from that is because the virus can even affect the fertility reproductive organ of a human, particularly male male, it will affect the testicle and can even affect the fertility of that person. So for women, it can lead to spontaneous miscarriage. You know, a woman will be carrying pregnancy, and suddenly, because of the Lassa, she can lose that pregnancy. So these are some few ones that and that is why we always say prevention is better than cure, and early intervention is very key for the survival of that person. The earlier you take a step in addressing the problem, the better. Otherwise, you may end up losing your life, or this complication can come from there.
Viewers, you're watching GMC TV live, and we're discussing Lassa fever. In case you're just tuning in, we're discussing Lassa fever. We have so far heard from the doctor and the community engagement specialist on how Lassa fever is transmitted from animal rodents, that's rats, from a rat to humans, and the manifestation of Lassa fever. It may start with common cold, but if it exceeds more than 3 days, report to the nearest health facility for checkup, or else it has a lasting effect. It could lead to deafness, and even for pregnant women, they may lose their pregnancy. So when in case you see people coming down with malaria and you think it has exceeded the normal days, please report to the nearest health facility. Lassa fever is real, and we are in the region that is endemic. Community and the engagement specialist, Mr. Paul.
Yes.
What have you done so far? What measures have you adopted to ensure that the community are enlightened to prevent this? As we said earlier, the prevention is better than cure.
Yeah,
to
exactly.
Prevent the spread of Lassa fever.
Yeah. Thank you very much. At Superbell level, we have a consortium with an organization called Jana Health Foundation, looking at disease outbreak, not only Lassa, but other related outbreaks, epidemic and pandemics in concern. So we come up with a program called Community Engagement in Pandemic Preparedness and Response. In this activity, what we try to do now is to bring the community into the platforms where health informations are being shared. Example, in the risk communications sectors of the public health, where community will be able to have access to right and accurate information so that they can be adhere to several disease outbreaks within particular regions, as well as entirely Nigeria. So now our focus is in 4 states in the northeast, that is Gombe, Bauchi, Adamawa, and Taraba. But however, we have engaged more people. So the process of engagement has to come with coalitions. Now, we understand that there are many coalitions in the community. We have religious coalitions, we have coalitions of people working with TB, we have coalitions of people working in association in regard to malnutrition and then malaria like Akome. We have coalitions of people living in HIV and many more. We have also youth coalitions like the Youth NYC Cup. So what we are doing so far, what we have done also, is now to advocate to those communities as well as the Ministry of Health, so that those communities will be part of the pandemic preparedness platforms. Examples like the risk communications and community engagement, where those communities can have access to accurate and timely information that will affect their members across the community. Now, these are not the only target we are working with, but if you look at TB Network, for example, it has so many groups under it, and it works directly with people. So if a member of TB Network will have access to accurate information, like for example within the set central, so this person can be able to disseminate information to their various locations within the state. Also, if you look at a network of people living with HIV, so if one person from the state will be able to have access to the pandemic platforms as well, looking at risk communications, looking at other outbreaks like One Health groups, so they can be able to have accurate information, and those information will be passed down to the community. Now, religious leaders are always on top of matter in terms of awareness. So if religious also will be part of this pandemic, I believe it will go a long way. And lastly, we always forget one structure which is very important, that is the youth structure. You know, in the NYC structure, we have the youth we have the community development services where youth severally engage across LGAs, across different structures. So if you are a member of NYC, you must belong to one group. So NYC also have a CDS, community engagement, related to pandemic or COVID-19 per se, to be precise. So if NYC will also be brought in to this kind of pandemic preparedness, it will go a highly long way, of which currently we have engaged in terms of bringing these people and making advocacies to the Ministry of Health, and then awakening their mind that this is what they need to do so that it will not stop what they are normally doing in the community as well. And all of those communities that we mentioned have bring and approve this idea. They want to be part of it so that they can prevent diseases outbreak and trends of several diseases. Like when you look at the COVID-19, when it happens recently, there was a trend from several countries down to Nigeria and to several communities. Had it been those kind of communities were part of it, they would try by much in terms of prevention as well as awareness in terms of the risks. Not only that, this Lassa fever that we are also talking about, from what doctor have said and then from several informations we have gathered, there has been a trend from another state to another state. For example, there was a trend from Taraba to Adamawa states of this Lassa fever. So, but communities are not aware of these diseases and then the trending. So we now try to bring those communities into the risk communication platforms. So by them being there, we believe that the sustainability is there, accurate information is being assessed, and misinformation, like I mentioned earlier on, derailing people from their normal meet, will actually be taken away and the right information will come into place. So we have done these advocacies, we have done the engagement of these communities at the sub-national level, that is at the state level, and we are also moving into the national level where we can see those communities at the national level within the NCDC, DC, TWG are part of the community engagement technical working group so that they can help in the designing of how communities will be engaged and how communities will participate in this aspect. Lastly, there is also the educational sector. Ministry of Education also need to be brought into concern. You know, we have teachers, we have students across different schools. So if the educations are also part of it, they will help in sensitizing, especially the younger ones, of hygiene, training them about hygienes, and then also sensitization we carried out among students within the educational sector. So if students in educations in school are carried out these informations, communities are carried out, NYC help us at the grassroots, and religious leaders have participated in the advocacies and sensitization. We believe this coming together with food force of community will now be like a system where community are taking ownership of their health sector. Thank you.
Okay, so how effective has that been in the prevention and treatment of Lassa fever? Do you think people are getting now aware that so much that the index case does not like affect so many people within that community?
Exactly. Thank you very much. And one of the things that we did attached to this has to do with airing of, we support the airing of preventions and then the spread of the diseases across, so that even if those communities were not part or they were not able to access you, so you can be able to have it through the radio. So, but currently, if you look at the trend of diseases last year, and what is happening this year, the diseases have actually reduced to some percentage because of engagement of these religious leaders and other communities. Now, religious leaders have helped us a lot in trying to do away with some of these myths, misconceptions, as well as involving other traditional leaders in collaboration with the religions, has able to reduce the activities of what people are doing within the community. Because, you know, when someone tells you that this is my meal, and if you hear it from your traditional person, as well as you also hear it from your religious angle, you will come to believe that the world is changing, you need to do more, you need to adapt with this kind of activities. And it has actually highly improved. If you look at the cases of Taraba now, it is drastically coming down. If you look at Gombe now, we are working currently in Gombe to increase more of the advocacy. And believe me, in few very time, the changes will change, and by next year, when we come back, we will see that Lassa fever has reduced, if has not gone on.
Sir, doctor, what are the treatment measures? Have they been effective, the treatment measures taken by the health experts to prevent Lassa fever, or to cure Lassa fever?
Okay, yeah, like I said earlier, that Lassa fever, you know, for it, as of now, we have only one treatment option for it, which is through the providing or giving antiviral drug, which is ribavirin. So this ribavirin is the one that is given for people that are diagnosed with the Lassa fever. So, however, the most important aspect of management of the disease is early report, early treatment. Whenever somebody is having the disease, before it has damaged the system or organs of the body, if measures are taken, that is the most important. The major cause of this damage and some complications that are seen as a result of decrease in the body water, maybe as a result of vomiting or as a result of diarrhea and what have you, an inability to take food when somebody is having the disease. So resuscitation is the best line of management by administering IV fluid, enough IV fluid to the person, and then managing symptoms. If somebody is having headache, you manage the symptoms of headache. If he is having diarrhea, you stop the diarrhea. If he is having common cold and all these symptoms that we have highlighted, once you are treating it that way, then it is going to really improve the management of the person, and then ultimately providing the antiviral drug, so which is the only way that that person can be saved. But in terms of the management of Lassa fever, you know, we always recommend early treatment. That is the best. So by the time that somebody maybe get into the hospital with complication, so it's difficult for you to be able to save the life of that person. And we always emphasize that that person needs to report early before, you know, we say it's gradual. So by the time that it's just starting, before it reaches the level that, you know, it's difficult for you to manage it, or you start losing blood, you know, you have to transfer the person and what have you. But if he didn't get to that level, you know, you can always manage that one. So that is how that can be managed. But in totality, the fatality rate is just 1%. People that are there, but people that get into the hospital, they are admitted, you know, that means they are getting into the hospital a little bit late. So the fatality can get up to 15%. So, but when you look at the community as a whole, there are people that can even get the disease and even they don't require any treatment. They just, the body will take care of it and so on and so forth. You know, viral disease, even our immune system can take care of it without really requiring that. But it's only very few that will now progress to a level that does. So by the time that they get into the hospital, it means any of the complications must have started. So that means he may require more treatment and so on and so forth. So the key message is for us to report early, and the medical personnel must have a high index of suspicion, especially now that we are having the outbreak. So every health facility, whenever they see any case of malaria or somebody with a common cold, they need to start thinking that can it be Lassa fever or not. So that is very key. And especially this season, dry season, is the time for this kind of diseases. So, and that is the dry season that some of these risk factors that we have highlighted are very common around that period, because it's the time that people are drying their food by the side of the road, and then keeping our environment clean, keeping our body very clean, especially washing hands and what have you. All these are things that will increase the risk of transmission of the Lassa virus.
Talking about health workers, there are instances we see even the health workers are infected. So what can they do to prevent?
Yeah, that is another aspect that precaution needs to be taken, and even awareness among the health workers needs to be strengthened so that they will always be using the universal precaution by putting hand glove, putting gown, and then putting face masks, and so on and so forth. So these are all things that can increase the risk of transmission. So even among health workers, like you have correctly said, is something that has to be taken into consideration. So, and it has been found that some of the victims are also from the health workers, either in the lab, people that are coming in contact with either urine or feces or even blood in the laboratory, they are at the risk. And even the nurses that clean the patient and so on, they are at the risk. So we need to sensitize them as well. And that is some of the responsibilities of the Public Health Department of the Ministry of Health, together with other agencies that are in the health sector, so that people are aware of this, and then all the required materials are provided. It is even more common among people that are cleaning the environment, like the cleaners. They need to take these measures, and then we need to use disinfectant all the time, and so on and so forth. So these are some measures that has to be taken.
So how can the One Health concept approach help in reducing this Lassa fever?
Okay, One Health, actually, when you look at One Health, has to do with bringing the livestock, those who are taking care of the livestock, forestry, as well as the health together. So One Health will help a lot, but except the members of the communities are also part of the One Health in terms of promoting messages that we pass through the platforms of the One Health. Now, One Health will inform that now people from the livestock agricultural sections will now inform the general platform that this is the period we are entering. These are some informations that we need to do. These are some things that we need to do. And if communities are part of it, communities will now take it back to the community. So also, in the health sector will say, now that we have entered this kind of period, as likely said by the persons from the agri or livestock, so we are suspecting, we are going to be suspicious of diseases like this and this and this. So communities will now take this information back to the community. And also in terms of forestry, they will tell us that this will actually affect so and so in terms of bush burning or other related activities. So this message will also be back to the community. But however, if this has not been strengthening and bring to the community into it, it will definitely not go a long way to the community. It will just be like a technical group where technicians are there, but communities are not there. Why those who are needed to be there to understand why those technicians are there are not present to answer and then to do their best. So One Health will actually impact as well as reducing the rate of disease outbreaks and other related activities within the community, because this involves key technicians coming together, technical persons coming together. But we also want to see community into it to promote it.
Doctor, what would you also say about the One Health issue in respect to Lassa fever prevention?
Yeah, and this is a new concept, although it has been there for a very long time, but with the issue of pandemic diseases coming up, particularly after the COVID, then this now concept is becoming more relevant and important. So what I want to say is that we need to really approach health as one, either from the agri, from the veterinary, from the health sector. So it's all our responsibilities, and every one of us, our hands must be on deck to address it squarely. Otherwise, if you just say, okay, we are only managing Lassa fever as Ministry of Health or as health sector alone, without carrying other relevant sectors together, then we'll not be able to address it squarely. So we need to look at the veterinary or people that are dealing with the animals and come together under one umbrella and approach the prevention, management, treatment, and what have you regarding disease outbreak as a holistic approach, not just only health. Otherwise, you can do your own bit. If you don't address the other one, the disease will coming back to us, and then year after year, and we'll not be able to get to the end of the whole thing. So I think the concept is very important. However, we need to really sensitize our general public as well as various sectors coming together. Now that the concept is becoming very, very relevant at this time around with the disease outbreaks that are coming. Because if we are approaching disease outbreaks in this, using this concept of One Health, then we should be able to address it squarely without any having any other problems.
Mr. Paul, before we wrap up this program, give us your final advice. What advice do you have for people on Lassa fever?
All right, thank you very much. First of all, let me start from the government aspect, especially the Ministry of Health. You know, we are bringing community new into consideration, but we want the acceptance of community into the preparedness of pandemic or epidemic of concern, disease of concern per se. But the attention is low, so we want more attentions of governments, especially Ministry of Health, so that they can open more hands for community to participate in terms of promoting sensitization, awareness into different communities. And for communities, when it comes to Lassa fever, all precautions has been set by doctor. We want all the communities to adhere to those precautions as well as prevention measures. And we should also be watching at the seasons where we are entering as it occurs, so that we can still stand by. Without being preventive, it will stop us from our economic activities looking at the current situations we are. Thank you.
Doctor, please, your final word.
Yeah, my final word is that first and the foremost, the role of the media and the community is very, very key for the success of addressing all these outbreaks that we are suffering from. So I think we want to really bring the media and the community together so that they will support us in fighting diseases outbreak. It's very important. You know, like the program that we are running like this, we always create awareness. And then the community is now taking whatever information to the communities by engaging with the traditional religious leaders, the youth group, and all this that he has highlighted is very, very important. Otherwise, if we sit down in the hospital, you know, we are just waiting for cases to come, then we will not be able to do that. And that is the importance of public health, to bring all relevant stakeholders together and then fight disease without really allowing the case to come to the hospital. So if you address it, you prevent it from happening, or you manage it at a very minimal stage, then you don't have this. But when you allow it to become a disease or a case, then a lot of resources will go towards managing such diseases. So I want to really emphasize the role that the media and the community will play in addressing disease outbreak. That is one. Then secondly, from our own aspect, issue of vaccine is very, very important, which a lot of progress has been made, especially with regard to the Lassa fever, whereby as of now, we have about 4 vaccines that are now almost at the second stage of clinical trial. That means within the shortest possible time we'll have the vaccine. And once you have the vaccine, then at-risk population can always be vaccinated, and that will really reduce a lot of pressure, a lot of problems that we are facing. So if you recall, with the vaccine for COVID, you know, we have been able to really manage COVID, and that, so that is why a lot of effort is now being put in place by the current administration, in which the vaccine clinical trial is on the way, and we are hoping that by the time that this trial is completed, we'll have our vaccine available, and this will go a long way in preventing or in addressing this problem of Lassa fever, because it's becoming worrisome. Before, you hardly have had it in 1 or 2 months, but if you look, every 2-3 months you'll have an outbreak happening in Nigeria. So that means something has to be done to stop this from happening on and on. It's now endemic with us. Unlike before, you hardly hear it, and despite all the measures that are taken. So that means the issue of vaccine is really given top priority by the current administration, which we believe, once it's available, is going a long way in solving that problem.
Well, viewers, we've come to the end of today's program, where we discussed Lassa fever prevention, care, and treatment. We've heard from the medical expert and the community specialist. All hands must be on deck to prevent the spread of Lassa fever, which is endemic in West Africa and the northeast Nigeria. So it's expected that we ensure personal hygiene, we ensure environmental hygiene, we ensure that we clean our environment and avoid bush burning, because when we burn bushes, we are bringing the rats back to our homes and they will infect our food. So it's expected that in our kitchen or wherever we put our food, we cover them so that rats will not play on it, and then when we eat, we get infected. And also, when we are taking care of any patient or somebody who has come down with Lassa fever, let's ensure that we wear hand gloves and ensure that we're cleaning the person we do not come in direct contact with, because we can also get infected. And for the health workers, let's practice standard procedures so that we also, while treating patients, will not come down with Lassa fever. Doctor, thank you for coming to our Health is Health program. We're glad you came and people were enlightened on Lassa fever. We hope that next time when we invite you, you also come to enlighten the people. Mr. Paul, thank you so much for coming.
Thank you.
Thank you.
Thank you.
Pray
Thank
that next
you.
time we also come and enlighten people on more diseases. Thank you.
Thank you.
Thank you. Stay tuned to GMC for more enlightening program.